Have you ever put your keys down and immediately forgotten where they are? Or walked into a room and completely blanked on why you went there in the first place? For many seniors, these moments of forgetfulness are becoming more frequent, more concerning. But what if I told you that the medication prescribed to help you might actually be making your memory worse? Last month, Martha, a vibrant 73-year-old who never missed her grandchildren's names, suddenly couldn't remember her own address when filling out a form at the doctor's office. Her family was terrified. Was this early-stage dementia? Alzheimer's? What they discovered instead shocked them. It wasn't aging that was stealing Martha's memory, it was her medicine cabinet. The truth is, many common medications prescribed to seniors can silently rob you of your memories, your mental sharpness and your independence. And the worst part? Most doctors never warn their patients about these effects, dismissing memory complaints as just getting older, when the real culprit might be sitting right there in your pill organizer. In today's video, we're going to expose the 5 medications most commonly prescribed to seniors that are known to cause memory loss and cognitive decline. These aren't rare drugs. Millions of Americans take these medications every single day without realizing the damage they might be doing to their brains. By the end of this video, you'll know exactly which medications to question, what to ask your doctor, and most importantly, what safer alternatives might be available to you. Stay with me until the end, because the last medication we discuss might be the most surprising. It's one that over 40% of seniors take daily, yet few realize its devastating impact on brain health and memory. If you're finding this information valuable so far, please hit the like button and comment awareness below to help spread this critical information to others who need to hear it. Now let's get started with the first category of memory-stealing medications. Medication number 1, anticholinergic drugs. One of the biggest offenders when it comes to medication-induced memory loss is a category called anticholinergics. These medications work by blocking a crucial brain chemical called acetylcholine, which is essential for learning and memory. What many seniors don't realize is that these drugs can be found in everything from over-the-counter sleep aids to prescription medications for bladder control, allergies, and even depression. Take James, for example, a 78-year-old who prided himself on doing the daily crossword puzzle without fail. After starting medication for his overactive bladder, he noticed he couldn't concentrate on his puzzles anymore. Words that used to come easily now escaped him. His doctor never mentioned that his bladder medication was an anticholinergic drug that could be affecting his cognitive function. Common anticholinergic medications include diphenhydramine, Benadryl, commonly found in over-the-counter sleep aids and allergy medications; oxybutynin, Ditropan, prescribed for bladder issues; paroxetine, Paxil, an antidepressant; amitriptyline, often prescribed for nerve pain or insomnia; dicyclomine, Bentyl, used for digestive issues. What makes these medications particularly dangerous is that their effects on memory can be cumulative. Many seniors take more than one anticholinergic drug, not realizing that the combined effect can dramatically increase their risk of cognitive impairment. So what can you do? First, make a complete list of all medications you take, including over-the-counter drugs and supplements. Ask your pharmacist to review this list specifically for anticholinergic properties. For sleep issues, instead of reaching for medications containing diphenhydramine, like Tylenol PM or Benadryl, try natural sleep aids like melatonin, or practice good sleep hygiene by keeping a consistent bedtime and avoiding screens before sleep. For bladder control issues, newer medications with fewer cognitive side effects may be available. The key is to start the conversation with your doctor, specifically asking, does this medication affect acetylcholine levels in my brain? If it does, ask about alternatives. Remember, never stop taking any prescribed medication without consulting your healthcare provider first. But also remember that you have the right to know about side effects and to explore alternatives that might protect your cognitive health. If you're still watching and finding this information valuable, please comment informed below to let me know you're here. Your engagement helps us reach more people who need this vital information. Now, let's move on to our second major medication concern. Asthma's medication, number 2, Benzodiazepines and sleep medications. If you've ever had trouble sleeping or dealt with anxiety, your doctor might have prescribed a benzodiazepine like Xanax, Ativan, Klonopin, or Valium. Similarly, the Z drugs for sleep, including Ambien, Lunesta, and Sonata, work in similar ways. While these medications might help in the short term, they come with a significant hidden cost to your memory and cognitive function. Consider Eleanor, a 72-year-old widow who started taking Ativan after her husband passed away. Her doctor prescribed it for her anxiety and to help her sleep. But after 6 months, her children noticed alarming changes. Eleanor kept repeating the same stories, forgetting recent conversations, and seemed confused about simple daily tasks. When her son researched her medications, he was shocked to discover that long-term use of benzodiazepines is linked to an increased risk of dementia. The science is clear. These medications affect the brain's ability to form new memories. They can cause both temporary memory impairment while you're taking them and possibly contribute to lasting cognitive damage with long-term use. Research has found that seniors who use these medications regularly have an approximately 50% higher chance of developing dementia compared to those who don't. What's particularly troubling is that these medications were never intended for long-term use. Most benzodiazepines were designed to be used for just 2 to 4 weeks, yet many seniors have been taking them for years or even decades. So what can you do if you're currently taking one of these medications? First, never stop taking benzodiazepines abruptly, as this can cause dangerous withdrawal symptoms. Instead, talk to your doctor about creating a gradual tapering schedule to safely reduce your dosage over time. For sleep issues, consider cognitive behavioral therapy for insomnia, CBTI, which has been proven more effective than medications. For long-term sleep improvement, without the cognitive side effects, simple habits like avoiding caffeine after noon, establishing a relaxing bedtime routine, and keeping your bedroom dark and cool can make a tremendous difference. For anxiety, ask about non-medication approaches like mindfulness meditation, which research shows can be highly effective. Some seniors find relief through gentle yoga, progressive muscle relaxation, or working with a therapist who specializes in anxiety in older adults. Remember that dependence on these medications isn't your fault. Many were marketed as safe without proper warnings about their cognitive effects. What matters now is taking informed steps to protect your brain health going forward. If you're still watching this video and finding these insights valuable, please comment knowledge below to let me know you're here, and if you haven't subscribed yet, I recommend you subscribe and turn on notifications so you don't miss our future videos about protecting your health as you age. Choice medication, number 3. Statins and cholesterol-lowering drug statins are among the most commonly prescribed medications for seniors, with drugs like Lipitor, Crestor, and Zocor being household names. These medications are prescribed to lower cholesterol and reduce heart disease risk. While they provide important benefits for many people, what your doctor might not have mentioned is their potential impact on your memory and cognitive function. Take Robert, a 75-year-old retired engineer who always had a sharp mind for details. After starting on a high-dose statin, he began struggling with simple calculations and forgot the names of tools he'd used his entire career. His wife noticed the change, but when they mentioned it to his doctor, they were told it was just normal aging. It wasn't until Robert read about statins and memory loss that he asked to try a different medication. Within weeks of switching, his mental clarity began to return. The FDA thought this connection was significant enough that in 2012 they required all statin drugs to carry a warning about memory problems and confusion. But many doctors still don't discuss this potential side effect with their patients. How do statins affect memory? Scientists believe it may be because cholesterol, while potentially dangerous in blood vessels, is actually essential for brain health. Your brain contains about 25% of all the cholesterol in your body, and it needs this substance to form connections between nerve cells. By dramatically lowering cholesterol, statins might be inadvertently affecting these vital brain functions. So what should you do if you're taking a statin medication? First, don't stop taking your medication without consulting your doctor, as high cholesterol carries its own serious health risks. Instead, have an informed conversation about the risks and benefits for your specific situation. Ask your doctor if you could try a lower dose, which might reduce side effects while still providing heart benefits. Some people do better on certain statins than others, so switching to a different medication in the same class might help. You might also discuss whether you're a candidate for a more targeted approach to heart health. For some people, lifestyle changes like a Mediterranean diet, regular exercise and stress management can significantly improve cholesterol levels without medication. Another important strategy is to support your brain health with omega-3 fatty acids, which many studies suggest can improve cognitive function. Consider adding fatty fish like salmon to your diet twice a week, or talk to your doctor about a high-quality fish oil supplement. Remember, heart health and brain health don't have to be an either-or choice. With the right approach, you can protect both your heart and your mind. If you're still watching this video and finding these insights valuable, please comment empowered below to let me know you're here. Your engagement helps this important information reach more people who need it. Now, let's move forward to our next memory-affecting medication. Dunservant medication, MOGA4, antidepressants. Depression affects nearly 7 million American adults over 65, but the medications prescribed to treat it can sometimes create new problems with thinking and memory. Certain classes of antidepressants, particularly older ones like tricyclics and some SSRIs, selective serotonin reuptake inhibitors, can impact cognitive function in seniors. Consider Margaret, an active 70-year-old who started taking an antidepressant after losing her sister. While her mood improved, she began having trouble remembering appointments and following recipes she'd used for decades. When she mentioned these symptoms, her doctor dismissed them as age-related, not recognizing they began shortly after starting the new medication. Antidepressants can affect memory in several ways. Some, like the tricyclics amitriptyline and doxepin, have strong anticholinergic properties, which we discussed earlier. Others may cause sedation that impairs attention and information processing. Even some commonly prescribed SSRIs like paroxetine, Paxil, have been linked to cognitive issues in older adults. This doesn't mean you should avoid treatment for depression. Untreated depression itself can cause severe memory and thinking problems, and in many cases, the benefits of treatment outweigh the risks. The key is finding the right approach with fewer cognitive side effects. So what can you do if you're concerned about your antidepressant affecting your memory? First, if you're noticing memory changes after starting an antidepressant, document these changes specifically and share them with your doctor. Being specific about when the changes started and what types of memory are affected can help your doctor make better decisions. Ask about antidepressants that may have fewer cognitive side effects in older adults. For example, some studies suggest that sertraline Zoloft and escitalopram Lexapro may have less impact on cognition than other options. Consider exploring non-medication approaches alongside your treatment. Strong evidence supports the effectiveness of cognitive behavioral therapy, CBT, exercise, social connection, and mindfulness practices for depression. Many seniors find that a combination approach works better than medication alone and allows them to eventually reduce their medication dosage. Remember, depression itself can cause significant memory problems, so treating it effectively is important for your cognitive health. The goal is to find an approach that improves your mood while minimizing impacts on your thinking and memory. If you're still watching this video and finding these insights valuable, please comment balanced below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on notifications so you don't miss our future videos about protecting your health as you age. Fasten to your medication number 5, prescription and over-the-counter pain medications. This last category might be the most surprising because these medications are among the most commonly used by seniors, pain relievers. Both prescription opioids and even over-the-counter options can have significant effects on memory and thinking, especially when used regularly. Take Thomas, an 80-year-old with chronic back pain who had been taking prescription opioids for years. His family noticed he seemed increasingly confused, forgetting conversations and getting disoriented, even in familiar places. His doctors kept increasing his pain medication without recognizing that it might be contributing to his cognitive decline. When a new doctor helped him transition to alternative pain management strategies, his family was amazed to see his mental clarity gradually return. Opioid pain medications like hydrocodone, oxycodone, morphine, and fentanyl work by attaching to opioid receptors in the brain. These same mechanisms that relieve pain can also cause mental fogginess, confusion, and memory problems. Long-term use can lead to more persistent cognitive issues that may be mistaken for dementia. But it's not just prescription pain medications that can affect your memory. Even over-the-counter options need careful consideration. NSAIDs like ibuprofen, Advil, Motrin, and naproxen, Aleve, when used regularly, have been linked in some studies to increased cognitive decline. Combination medications for PM pain often contain diphenhydramine, Benadryl, which has strong anticholinergic properties that we discussed earlier. So what can you do if you're dealing with chronic pain but concerned about protecting your memory? First, work with your doctor to develop a comprehensive pain management plan that doesn't rely solely on medications. Many seniors find significant relief through physical therapy, acupuncture, massage, water therapy, or gentle movement practices like Tai Chi. If you do need medication, discuss the start low, go slow approach with your doctor, using the lowest effective dose. Intermittent rather than continuous use can also help minimize cognitive side effects. Consider non-drug alternatives for mild to moderate pain. Heat therapy, cold packs, topical analgesics, or even techniques like meditation and guided imagery can provide relief without affecting your brain. For those currently taking opioid medications, never stop these suddenly, as withdrawal can be dangerous. Instead, work with your healthcare provider on a safe tapering plan if you both agree that reducing these medications is appropriate. Remember, that pain itself can interfere with cognitive function, so the goal isn't to avoid all pain treatments, but rather to find the approach that offers the best pain relief with the least impact on your memory and thinking. As we've seen throughout this video, many common medications can have hidden effects on your memory and cognitive function. From anticholinergics to benzodiazepines, statins to antidepressants and pain medications, these drugs might be silently impacting your brain health without you even realizing it. But knowledge is power. Now that you're aware of these potential issues, you can take proactive steps to protect your cognitive health. Create a complete list of all medications you take, including prescriptions, over-the-counter drugs, and supplements. Review this list with your pharmacist, specifically looking for medications that might affect cognition. Schedule a medication review with your doctor. Ask specifically about each medication. Is this known to affect memory or thinking? And are there alternatives with fewer cognitive side effects? Never stop any medication suddenly on your own. Always work with your healthcare provider on a safe approach to changing medications. Consider a deprescribing approach. Many experts now recognize that seniors are often over-medicated. Ask if any of your medications could be reduced, eliminated, or replaced with non-drug alternatives. 5. Support your brain health through lifestyle approaches, regular exercise, a Mediterranean-style diet, quality sleep, stress management, and staying socially and mentally active. Remember Martha from the beginning of our video. After her frightening episode of memory loss, she worked with a geriatric specialist who recognized that several of her medications had anticholinergic properties. By carefully adjusting her medication regimen, Martha's memory largely returned within 2 months. Now she teaches other seniors in her community about medication safety. Your brain health is too important to leave to chance. You have the right to understand what your medications might be doing to your memory and to make informed decisions. Along with your healthcare providers, thank you for joining us today. We'd love to hear from you. Leave a comment below and share one thing you learned today and how you plan to use it in your life. Your thoughts are important to us, so don't hesitate to share them. If you found this video helpful, please like, subscribe, and share it with someone you care about. Your support helps us continue creating informative content to help seniors live their healthiest, most vibrant lives. Thanks for watching, and we look forward to seeing you in our next video.